I'm Dr. Libia Scheller from the Institute of Medical Education and Research, and I have with me today Dr. Leonard Gomella, Chairman of the Department of Urology, Associate Director of Clinical Affairs at the Jefferson Kimmel Cancer Center at the Thomas Jefferson University. Thank you so much for being here today. Can you tell me a little bit about your background?
Well, I grew up in New York. I had a great medical school and residency training experience at the University of Kentucky in Lexington, Kentucky, and then went on to the National Cancer Institute, where I was able to work in the surgery branch as a fellow for a couple of years. And then in 1988, I went to Thomas Jefferson University, and I've been there ever since. I've been very involved with translational research in urologic oncology there.
So you're a urologist by training?
Urologist by training.
Wonderful. Can you tell us a little bit about the area of in urology and what's happening right now in the landscape of medical oncology and how it's important for urologists to stay abreast of, with the landscape that's going on right now in the treatment of prostate cancer?
Well, the changes have been amazing. Before about 2004, with the approval of docetaxel, there were very few medical oncologists that had a strong interest in dealing with prostate cancer, and it was primarily dealt with by the urologists with very, very late referrals to medical oncologists. Well, with the approval of docetaxel in 2004, the game changed. Medical oncology had more of a role in the management of these patients, and as the last 8 to 10 years have progressed, the number of new agents that have come forward, new mechanisms, new forms of actions, new pathways that are targeted, the involvement of medical oncology in general in advanced prostate cancer has gone up exponentially. So it's very critical today that urologists maintain a good perspective on what's happening, because there are so many, there's literally dozens of agents which are in near-term clinical trials that may be applicable to our patients with prostate cancer. So it's very important for urologists to maintain the cutting-edge information that's out there as more and more medical oncology involvement is happening with advanced prostate cancer.
Terrific. It's a very exciting time in the area for urologists and medical oncologists. So what would you say is the best way to go about for the urologists who want to know a little bit more about what's happening in the area of medical oncology and how it's going to affect them? Where's the best place to find that education? What types of meetings and what kind of CME can they look for?
Well, I think a lot of urologists don't go to large medical meetings such as ASCO and that type of venue. So I think the satellite symposiums that are often offered at our large urology meetings are very important. I think very specific and CME approved programs that are available in many venues, whether they're through monographs or through online presentations, are really the best way for urologists to maintain their level of understanding of what's happening in this very dynamic time.
And what do you think on a short term is going to be the biggest area that's going to be affected effective for urologists? What do you think, coming down the pike, the agents that are going to affect their practice the more?
I think things are going to go back and forth a little bit between medical oncology and urologists. Urologists are very comfortable dealing with oral agents as well as injectable agents that are non-therapeutic, non-hematologic in nature, causing suppression of the bone marrow and things like that. The newer agents that are coming down, a lot of them are going to be more traditional hormonal manipulation that can be done through oral agents, and I think the urologists may come back into some of those primary manipulations that happen with patients as they develop advanced prostate cancer.
Wonderful. Can you tell a little bit for the audience, for the urologists, the importance of, we actually just finished a video Viewpoints in the area of metastatic prostate cancer. Can you tell a little bit to the urologists in the audience listening right now the importance of educating themselves with this video Viewpoint?
Well, I think it's important to understand that with these new agents that are out there, be they in development or already available through FDA-approved mechanisms, to understand that considering early referral to medical oncology today, particularly when your patient is manifesting metastatic castrate-refractory prostate cancer, is a very important thing that they really need to keep an eye on.
Great. Well, wonderful. Thank you very much.
Thank you.